Good afternoon. We will get started in just a moment. All right, good afternoon. It is 2 o'clock. We're going to go ahead and get started. Thanks for joining us today. On the briefing, we'll hear from Milwaukee Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management, Darren Rausch, Health Officer and Director of the Greenfield Health Department, and Dr. Molly Cousin, a pediatrician with 16th Street Community Health Centers, will join us to talk about flu shots for children. As a reminder, some of our guests will be answering questions from the public submitted on social media before we move into the Q&A portion of the briefing. Mayor Barrett, you're starting us off today.
Thank you very much, Sydney, and good afternoon. I want to begin by talking a little bit about the testing numbers. Our National Guard testing number as of Tuesday, September 22nd, at UMOS on the south side, we tested 1,034. Custer on the north side, 5,049. That gives us a Milwaukee total this week of over 3,100. So these are pretty solid numbers, and we're pleased to see the increase. Dr. Weston will talk more about the positivity rate and the challenges we have moving forward. But it's important for us that people are continuing to get tested. I'll also say that we are working on the transition plan that's going to be put into place. We have really benefited immensely from the presence of the National Guard as really our partner for the last 4 months, roughly. And things are going to change there, but I just got off a pretty extensive call, a planning call as to how we're going to transition once their deployment ends. And so a lot of this will be transitioned to the city. So there'll be more details Tuesday as to what's going to happen as the National Guard. Again, we're very thankful to the governor and to the National Guard. They've been tremendous partners. But we knew that was a temporary solution. And so we are working to develop something with our staff. And not surprisingly, the City of Milwaukee Health Department staff has been working around the clock to not only deal with this issue, but all these issues related to COVID-19. So we're very thankful for that. We continue to work with our partners on the CARES Act dollars. Those are the federal dollars that have been allocated to the City of Milwaukee. And we put a significant number of those dollars into the health department, some into the fire department, some into police, other city departments. We've also put a significant amount of dollars, over $16 million, into helping people stay in their homes for mortgage relief or for relief for rent primarily. And so we're partnering there again with the state of Wisconsin to do everything we can. A third place where we have really tried to make a significant impact is with the small businesses. We know that a lot of small businesses have been impacted by COVID-19. And through the first flurry, we knew that there were the loans that went oftentimes to larger businesses. And we felt that a lot of the smaller businesses here in Milwaukee were being left out in those loans. So we worked very hard to create a program. Our Department of City Development created a program that we called Restart. And those were Restart grants that allowed small businesses with 20 or fewer employees to apply for these grants. And we had some solid success. We had businesses from every aldermanic district in the city that applied for and received these grants. And we were so pleased with that. We thought, well, let's go back. Let's go back for a Restart Grant 2.0. And so we are working collaboratively with the Milwaukee Economic Development Corporation on Restart 2.0 grants. This is an application period that will begin on October 1st through October 8th. So it's a week-long time for businesses to apply. New details and application information is available online at milwaukee.gov/restart. But again, this is for businesses, established City of Milwaukee businesses with 20 or fewer full-time employees and an annual revenue of less than $2 million. Those are the entities that will be eligible for this. So it's focused almost exclusively on small businesses. Businesses that received Restart grants initially are invited to apply again, but no business can receive a combined total of more than $25,000. In addition to grants for personal protective equipment, restocking perishable inventory, and physical improvements to reduce COVID-19 spread, grantees can use money from this round of restarts for some rent and utility payments and winterizing outdoor spaces. We all know winter is coming now that autumn is here officially, so it's only a matter of time. But I think one of the successes we've seen through this is how businesses, restaurants in particular, have been able to adapt with a lot more outdoor dining. And we know that will get more challenging as the temperatures drop. But we think that we can get pretty deep into the year here with outdoor spaces, particularly if there's some winterizing that was done to make them usable. So several new categories of businesses can apply, including home-based businesses, food trucks, licensed daycare, and state licensed group homes. They're all eligible to apply as well. The city has engaged the Latino Entrepreneurial Network, the Milwaukee Urban League, and the Wisconsin Women's Business Initiative, WIBIC Corporation, to assist small businesses in preparing for online applications. So if you feel you need help, contact WIBIC or the Urban League or the Latino Entrepreneurial Network to help you apply for this money, or you can obviously do it on your own by going to the website. The other issue that I want to mention, because it is very, very timely right now, is I need you. I need you to be counted in our census. I think it's significant when you look at the census and how important it is that, and I'm not going to get real religious here or anything like that, but if you think of Jesus and Mary and Joseph, they returned to their hometown for the census. That's the biblical story as to how they arrived in that manger, was they were back to be counted in the census. If you look at our founding constitution, it states that every 10 years there shall be a census in the United States. So there are religious roots to our census, there are constitutional roots to our census, and boy, oh boy, there are practical roots to our census, because so much of the federal spending for a lot of programs is based on population. And so we want to make sure, both from a fiscal standpoint, but also from a government representative standpoint, that people are responding to the census. So I want to end my remarks by reminding everyone that the 2020 census deadline is fast approaching and is now just 6 days away. So please get yourself counted. This means that in order to be counted, you must respond to the survey by September 30th. Right now, Milwaukee's self-response rate is at 60%. We are lagging behind the national average of 66%, and we are lagging behind Wisconsin's response rate of 71%. So I need people in the city to please respond. So, as I said, census data is collected just once every 10 years and determines how the federal government will distribute money to local communities for health, for education, for housing, and more. And Wisconsin receives $12.6 billion based on census data. And Milwaukee gets a significant part of that. So if people aren't counted, we don't get the amount of money that we really should be receiving based on our population. So please, as we near the deadline, do your part and complete the census online at 2020census.gov or over the phone at 844-330-2020, or answer your door when a census taker stops by your home. I was out walking the other night and I saw a census worker out there trying to get people to fill out the form. So again, please do what you can. It's important for all of us. And with that, I'm going to turn over to our partner, County Executive David Crowley. Mr. County Executive.
Thank you so much, Mayor Baird, and thank you for your leadership. I really want to start today by acknowledging the events in Louisville following the ruling and the shooting death of Breonna Taylor at the hands of police. There are no words that can ease the pain for the family of Breonna Taylor, who have basically seen the system fail them a second time. And nothing can be said to make sense of this ruling for those who have demanded justice to hold Breonna Taylor's killers held accountable. Protesters who've marched our streets almost every night this summer demanding change have every right to be upset and frustrated by yesterday's news. Not only do I see you and hear you, I get it. And while you're out exercising your rights, please remember to stay safe. So wear a mask or face covering over your nose and mouth. Practice physical distancing by keeping at least 6 feet away from other people. Wash your hands as frequently as possible with soap and water, and use hand sanitizer. If you don't feel well, stay home. If you're experiencing any symptoms of COVID, get tested as soon as possible. Next, I'm pleased to share that today I joined representatives of Wisconsin lenders, landlords, realtors, and tenants in asking Wisconsin congressional delegation for additional federal finance relief to help communities and businesses recover from the economic cost of the COVID-19 pandemic. As this pandemic goes on, the economic challenges continue to grow, and the burden on our community is substantial. We need funds to ensure that we're not only containing the spread of COVID-19, but also limit the potential economic danger to lending and housing and local governments that stand to be hit the hardest by the pandemic and its economic consequences. I want to thank our partners who joined in this bipartisan request for local aid, which includes Wisconsin Counties Association, the Wisconsin Bankers Association, Wisconsin Realtors Association, the Wisconsin Apartment Association, Wisconsin Credit Union League, Legal Aid Society of Milwaukee, Community Advocates Incorporated, Apartment Association of Southeastern Wisconsin. COVID has had a $300 million impact on Milwaukee County, and that's from lost revenue to reopening costs. It continues to provide critical resources and services during this pandemic. And so I want to urge the entire Wisconsin delegation to help secure additional direct assistance to local governments so we can continue to address these critical needs in our communities. And then finally, with the coming of influenza this season, I want to once again encourage everyone to get your flu shot. Getting the vaccine protects you and your family and your community. We need to do everything that we can to keep people out of the hospital. And later on, we'll be hearing from Dr. Molly Cousins, a pediatrician with 16th Street Community Health Centers, in just a little bit about the importance of the flu vaccine for our children. And with that said, I'd like to turn it over to Dr. Weston for our latest numbers. Thank you.
All right, thank you, Mr. County Executive. Good afternoon, everyone. First to our numbers, we have had 27,664 confirmed cases of COVID-19 in our community and 425 individuals who've died. We continue to see areas of concern throughout the county, and on evaluation today, we're changing the key indicator for cases from yellow over to red. It's based on a sustained increasing trend in percent positivity of tests. In the county, we're also seeing a bit of an uptick in COVID-19 hospitalizations, as our county is beginning to reflect the increasing burden of disease of the state more generally. In fact, the state, Wisconsin, now has more COVID-19 hospitalizations than any other time since the pandemic began. These very worrying trends in our community naturally lead to concerns among the public. And for that reason, I wanted to focus today on a few questions that we received through Mayor Barrett's Facebook page. One question came from a gentleman named Hercus M, and that question was, why is the PCR test for the virus routinely, why is the PCR test for the virus done routinely, but not antibody testing? So it's an important question, and these two tests have very different purposes and different implications. The PCR test, on one hand, is the most common test that we're seeing for COVID. It's typically a swab in the nose. It's sent to the lab then analyzes it to look for the genetic material from the virus. This is the most accurate way to see if you currently are infected with COVID-19. On the other hand, the antibody, or sometimes called serology test, this is a blood test. It looks for antibodies that are created from a previous COVID infection. This test informs on whether an individual has had the infection in the past. So the focus on tests in the current phase of the pandemic has been primarily on PCR tests, as they inform individuals fairly rapidly if they're infected so that they can isolate and prevent the transmission of disease. And a big part of the reason why we're not seeing as much individual antibody testing being done is that we don't fully understand yet the implication of a positive test. So while it may be personally interesting to know that you've had COVID in the past, it's unclear how protective that previous infection is in preventing reinfection. Certainly, as a vaccine is developed and the understanding of antibody tests and sustained immunity is better understood, it's very likely that we'll see more of those types of tests being useful in the community. So next, a question from Nana G, who asked, with the cases of Milwaukee increasing, why have in-person school? So certainly we want to be extremely careful with any in-person activities that are mixing different households. Schools, in particular grade schools, so far appear to not be an area of high transmission for COVID-19. And looking at the available research out there, it seems that the younger children are, unlike many other viruses, they're not as likely to transmit COVID-19 as younger adults, for example. The health departments and other local experts have worked very closely with our schools to put in place masking policies, cohorting, and physical distancing policies. Each school and each community is working to find that balance between the clear need to protect our children and their families from virus transmission on one hand, and to ensure that our children are educated and socialized on the other. So there's no perfect solution. We continue to learn during the pandemic about the best ways to balance safety and everyday activities. And finally, a question that has not only appeared on the mayor's page, but throughout social media in regard to a CDC report from a few weeks ago showing comorbidities or other medical conditions associated with COVID-19 deaths. So it's been widely discussed that this report showed comorbidity data on COVID deaths, and 6% of deaths had no comorbidities. So many have used this to downplay the severity of the pandemic and say that really there weren't that many people that died of COVID. So this is really a misguided view of the data. So when a virus such as this attacks the body, it can cause chronic medical conditions that are typically quite manageable. So things like diabetes, heart failure, lung problems, liver disease, that people live with every day to become far worse and to become deadly. It's also important to note that the data from the CDC comes from death certificates, which often list and typically list other comorbidities. So for example, if one of the many people in the world who lives their daily life with diabetes and gets along just fine is infected with COVID, they get hospitalized, and unfortunately they ultimately die. While diabetes may be listed on their death certificate as a comorbidity, which it certainly is, and as a contributing factor, which it certainly was, the COVID infection is what ultimately led to their death. In our county in particular, our medical examiner's office is very careful. They go through every case individually and remove from the COVID-19 death count, the count that you see on our dashboard, cases where COVID positivity was incidental and not the true cause of death. So thank you for these questions. Please continue to send questions along to the mayor's Facebook page. We'll continue to try to work on answering them. And lastly, again, please keep wearing your mask over your nose, maintain your physical distancing outside of your household, and seek out testing when needed so we can hopefully reverse these dangerous trends we're seeing in Wisconsin. Thank you and stay safe, and I will hand it off to Director Rausch of Greenfield.
Thank you very much, Dr. Weston. It's my pleasure to join this afternoon and share a little bit of a data update related to COVID-19 in Milwaukee County. We're going to go ahead and start this week by looking at the data for our kids in Milwaukee County. And what you see here on the screen is the daily new cases of Milwaukee County children who have COVID-19 under the age of 18. And you'll see when I turn the page and look at another report, you'll see the trends are very, very similar. We've now entered what looks like the third peak for kids under the age 18. We have a peak back here in May, we had a peak here in July and August, and it looks like we're heading in that direction once again with increased cases throughout the county. Any report we do with kids, we're always very careful about sharing that data because there are some kids who are 18 who are of legal adult age but still may be in high school. So this report includes those that are 18, and it also excludes in some of the tables and charts those who are 18. So it really depends a little bit on what table you're looking at, but when we look at the table comparison side by side, we see the trends are very similar whether we include 18 on the top or just look at 17 and under. One of the things that we've done differently in this report this week is we've broke down the age of the kids a little bit differently. So you can see here we have 6 different age groups. We've separated out the 18-year-olds themselves, and we see largely all of the ages kind of mimic each other with the exception of the 15 through 17-year-olds, which have a higher burden of COVID disease. And as we've seen before in other charts, including this one here, we have seen that as kids age, it seems like they have more opportunities to interact with others, go out. And if they're not doing that in a safe way at work, school, sports, whatever activities they're engaged in, they're more likely to contract COVID. And we see certainly an increased amount of COVID starting at age 14 and continuing through age 18. Similarly, we see those who are older who are tested more because they've obviously had symptoms of disease more frequently. So shifting gears here a little bit, we'll look at the entire county report, and that is what is on your screen right now. This is the overall look at new cases of COVID throughout Milwaukee County, 0 through 100 plus in terms of age. And we again see the 3 distinct peaks, but very pronounced in the city of Milwaukee and just a very little blip in the suburbs back in May. But very marked increases in July in both the city and the suburbs. And certainly it looks like we're on the early side of an upswing in both the city and the suburbs at this point. We've been carefully monitoring deaths over the last several months as well. Deaths are largely steady since July. Again, these are a lagging indicator, so while we don't see a lot of deaths in the most recent days, the deaths are often reported a few weeks after the initial case is identified. So there is a little bit of a lag there in the data. We've been tracking transmission rate for a long time, or the reproductive number, and unfortunately, I have to point out this week that we have surpassed 1.0. And the mark of 1.0 is important because a result of 1.0 means that for every one person that was infected with COVID-19, they would on average pass that disease to one other person. What we show here on the screen is we're above 1.2, 1.3 in terms of our transmission. And that's problematic because that means there are more cases coming from every case that's diagnosed. So this is something that we're concerned with. This week's data, I will note, and also next week's data would be heavily influenced by any end of summer or Labor Day gatherings or parties that may have been held without giving credence to masks and distance and all of those important things that we've talked about in previous weeks. So we see a marked increase in our transmission rate for the county as a whole, and then when we compare the city of Milwaukee to the Milwaukee suburbs, we see a very similar trend here as well. We see increases in both the shape of that trend, and the increase seems to be a little bit more pronounced in the city of Milwaukee versus the suburbs, but both are very concerning to us and indicative of increased disease transmission, which we are seeing in the cases. One of the new things that we added to the report this week is we added a new age group, and specifically we wanted to tease out the young adult population that may be college age. The narratives across the country and across the state in many parts of Wisconsin have really centered on those young adults on college campuses driving incidence rates or cases of new disease in the area. What I can say here in Milwaukee County is that is not the case. The 18 to 24-year-old age group is the third highest age group. We continue to see more cases of disease and higher rates of disease in the 25 to 39-year-old population, as well as the 40 to 59-year-old population. And that's very important to understand and realize. So it's not the college kids driving our rates. It is the next two older age groups between 25 and 59. And what's important about that, as we talk about other things like school reopening and cases in schools, is that these are the age groups that most likely have school children in our schools, and potentially that is the source for COVID-19 to get into our schools. I'll just continue here to talk a little bit more about not a whole lot of changes in hospitalizations as we add the new age group. We certainly continue to see the highest rates of hospitalization in the oldest age groups, and that decreases as we go on with age. And similarly, the deaths has a similar trend, highest amongst the older age groups, and certainly 3 times higher in terms of the rate. One important caveat to note about deaths is that the white population has far surpassed the African American population, and we see that here in the lower left. The white population has surpassed the African American population in terms of death. That happened back in early June, and it's even grown wider since then. So again, something we need to continue to watch. But although the cumulative number is higher for the white population, the Black African American population has one of the highest rates. And that certainly bears further consideration. I'm happy to report that testing coverage has increased in the most recent weeks. That has been a story that we've been talking about since early July, with decreased testing over the last 2 months. But last week we had nearly 20,000 tests, and this week, and in the most recent week, we've had almost 17,000 tests. So that's good to see more people accessing the tests that are readily available throughout Milwaukee County. Lastly, for data, I'll leave you with our maps. When we look at the entirety of the outbreak, we see disease throughout Milwaukee County. This looks at March 6th through September 22nd. And then when we look more specifically at the most recent week, so this is data from September 16th through September 22nd, we see cases very similarly laid out to last week. We see a lot of cases on the east side and the south side of Milwaukee. We see a lot of cases continuing into the North Shore communities, Wauwatosa, as well as pockets of high rates of disease in the southern suburbs. And all of this bears careful consideration. Looking at increasing education and testing to those areas would be an appropriate reaction and interaction with that data. So lastly, I just want to end with a couple key points and summarize a couple of the questions that I've been asked and that were shared with me from the Facebook posts as well. So what we see here today is we continue to see high disease cases and high rates of disease, with much of that current increase centered in the city of Milwaukee, both spatially, but we know there are higher and increasing rates of disease throughout the county. With the larger growth in cases, that's mostly been amongst those older young adults, those 25 to 39, and this narrative doesn't center on college students, but rather centers on the older populations, again, older 20s and into the 40s and 50s. The trends we see here in Milwaukee County are very similar to what we see and hear about in other parts of the state. As mentioned previously, the contribution to the statewide totals of Milwaukee County has been decreasing over the state. Wisconsin continues exceedingly almost 2,400 cases again today, which continues to signify a surge of COVID statewide. When we look at all this data, it reflects on the school question that Dr. Weston asked earlier. I'm continued to be asked that by people in my district who know I work in public health. I'm continued to be asked that by other members of the community in Greenfield in which I work. And when I look at the data rates and the disease rates by municipality in Milwaukee County, there's no clear discernment between school status, that is, whether they are currently in person or virtual, and case trends. And that can be confusing, but I think that also just tells us that the narrative is more consistent with the reality that community-wide transmission, what's happening in the broader community, is driving case rates more than what's happening in school settings. And while we know that there's potential for transmission of COVID in school settings, most of the time we're seeing that transmission occur in the community. And so while cases are identified in school settings, it seems that the primary direction of transmission is from the community into the schools, and the schools have been doing a great job of trying to lessen that to the extent that we mentioned earlier, with cohorting students and wearing masks and doing all of the things to lessen disease transmission. Most importantly, on the school issue, our school boards in the communities that have opened virtually will be making some key decisions this week about what is going to happen with their learning modality come the next couple weeks. They'll continue to be working with public health leaders like myself to understand the data for their community, to contextualize that data within the data for Milwaukee County, and make informed decisions. And so we do share the data that I've shared here with you today and much more data with school boards and school leaders on a weekly basis. Lastly, another question from the Facebook page was about when are we moving into the next phase? And sadly, that's a question that's very easily answered today based on the data. And quite frankly, because the data is increasing, we're not moving into the next phase anytime soon. Our key indicators countywide are not improving, and the key indicators that are being tracked even in the city of Milwaukee are not improving. Right now at a county level, we are tracking 5 key indicators. We're tracking cases, testing, care, healthcare capacity, personal protective equipment availability, and contact tracing. Right now, as of today, those indicators were updated. Cases remains red because of the surge in cases I've mentioned earlier. Testing remains yellow because we still have some capacity that's being unused. So please, if you need a test, you can access a test and you can call 211 and other places to get information on testing. Our healthcare capacity remains green, and that's been a very positive indicator. Our PPE remains yellow, which means there's some PPE available to healthcares, but not at the level that they would like to handle a potential surge should one arise. And lastly, contact tracing is an indicator that measures the capacity of the local health department to complete disease investigation and contact tracing for all of the COVID cases we're seeing. Unfortunately, that is yellow and rapidly approaching red due to the large increasing number of cases we've seen in the recent weeks. So with that, I end today's comments on the data and what we're seeing in terms of COVID-19 in Milwaukee County, and I will turn the briefing over to Molly Cousin from the 16th Street Community Center.
Right, thank you so much. I think this, all the data provides a really good context as to why influenza is important to address while we're talking about COVID. I think if you look at a lot of those prevalence maps and think about laying over what is influenza going to do on top of those, we really don't know what's going to happen. And so we know that the same things that prevent COVID, wearing your mask, washing your hands, staying socially distanced from folks who aren't living in your household, and staying at home when you're sick, are all going to be preventing influenza as well. But we have something extra we have to do to prevent influenza as well, and that's to be vaccinated. It's kind of like the safety features on your car. Just because you have our airbags, it means you don't use a seatbelt or you don't use your brakes. Everything kind of we need to do together. And the influenza vaccine is a safe, effective way to have your immune system ready. Protect yourself against the influenza season when it starts. It's between October and April is when we see those various peaks of the influenza virus coming through the community. And more difficult for us this year is going to be the fact that the symptoms of COVID influenza are very similar. Both of them weaken your immune response, and you're more likely to get secondary infections or worsening of chronic diseases when you have influenza. But unlike COVID, influenza is really a serious disease for children. I think a lot of this was missed with the coverage on COVID, but the last flu season was actually one of the worst for children on record, with the highest hospitalization rates for children. Our communities that are more affected by influenza, like the Native American children, children with chronic disease, definitely have more problems with influenza, but over half of the children who were hospitalized last year with influenza had no other medical conditions. So these are otherwise healthy children who get sick enough that they need to be admitted to the hospital for oxygen support, for IV fluids, for antibiotics for those secondary infections. So we know that if you're vaccinated against influenza, children are much less likely to need to go to the emergency room or need to be admitted if they do come in contact with the flu, because their body is primed and ready to fight off the influenza vaccine. So the flu vaccines are recommended for everybody over the age of 6 months of age. The first year that you get your flu shot, if you're under the age of 9, you need to get a second dose at least a month or later afterwards, just to boost up that immune system. Flu vaccines are really, fairly quick to give. There's the injection, the inactivated virus that you get, or else this year there's also the nasal spray, and you can get those and kind of go on your way. We want folks starting to be vaccinated right now. Between now and the end of October is the time we'd like people to be getting those flu shots, because your immune system is going to be building up after those vaccines, so you're ready for the wave of the influenza virus that we are expecting to happen throughout the winter and spring. Clinics are stocked with flu vaccines, pharmacies are stocked with flu vaccines already. And for folks who might be worried about access or cost, the health department as well is a great resource for the flu shot as well. We know that our Latinx and Black communities in Milwaukee have been disproportionately affected by COVID due to a lot of the social and economic inequities that are in the community. And unfortunately, these are the same risk factors for influenza as well. Essential workers are still coming in contact with folks every single day. And we know that kids are more likely to spread influenza than COVID. And so it's important that our children are being vaccinated so they're not the ones spreading influenza within the households, and the other way around. So folks who have to go out and work, or who have to live in more close settings, that they're not passing it around the household. So we really do recommend that everyone get their children and themselves vaccinated against influenza this year. We know that those young babies, 0 to 6 months old, they can't be vaccinated. And so it's important that anyone who has a baby in their household is vaccinated, so they're the ones who are protecting those babies against the influenza virus when it comes around. We want to make sure that everyone stays healthy this season. Everyone stays, they're not in the emergency rooms, they're not in the hospitals, they're still working, or they're still attending school. So it's very important to start looking and to for those when those flu clinics are happening in the community. The influenza vaccine is one of the vaccines that a lot more folks are hesitant about receiving. And I think it's one of those vaccines that if you have any questions, any concerns, please talk with your healthcare provider. This is what we like to do. This is what we want to do. We want to have a conversation with you about what you might be concerned about. We want you to make sure that you're making a good informed decision about why you should be getting the flu shot and why it's important for you and your family. So please reach out to your healthcare providers to talk about it because we want to make sure everyone gets vaccinated this season.
Thank you, Dr. Cousin. We do have one quick question from social media for Mayor Barrett. Mayor Barrett, where can we get free masks?
Well, we're working on a number of places right now with our health department. And let me get I don't want to give the incorrect information. So I believe we're starting to have them at our health clinics. But maybe I can get an answer in the chat from someone from the health department and give an accurate answer. I know there is someone on the department, but I'd rather not give out the wrong answer to that. So let me see what we can before the end of this call, that we can get the right information.
Got it. Thank you. Our first question from the media comes from Mary Spacuzza at the Milwaukee Journal-Sentinel. Are you hearing reports of parents sending students who have tested positive for COVID-19 to school? If so, what's being done in those situations?
Yeah, I'll take that question. I reported as recently as 2 weeks ago about rumors of this sort of thing happening. My colleague Kirsten Johnson in Washington, Milwaukee County was in the media earlier this week talking about this, and it has been something that's been happening in that community since school began. I've talked to other colleagues throughout Milwaukee County today. None of us have experienced this yet. And if it does occur, we will address it with the parents and with the school district. I think what really underscores the strength of our relationships throughout Milwaukee County is the relationships with the schools and the health department. And we need to, because of situations like this that have occurred, work even more closely in making sure that kids that are on the COVID positive list are being appropriately excluded from school. And that just requires a couple additional contacts and some enhanced communications between both local public health and the school districts. It's very unfortunate that something like this happens. I would certainly want to call out to all parents that it's appropriate to do your part and to keep your child appropriately isolated at home if they are sick with COVID, so that they do not transmit COVID-19 to other school classmates, teachers, and staff in the building.
Cindy, this is Tom Barrett. If I can weigh in here, I've got the answer to the previous question. The Milwaukee Health Department is still distributing free masks at the Keenan Health Center, at the Northwest Health Center, and at the Southside Health Center. And if you want more information, you can get that from milwaukee.gov/coronavirus. So I want to do that. And I want to follow up Darren's comment about kids going to school who have tested positive. I think that there's a fallacy out there. Well, if the kids don't get that sick, if they get other kids sick, what's the big deal? First of all, some kids can get pretty sick. Second, there was just an article that I saw last week about a teacher up in the Green Bay area who died from COVID-19. And so it's not just the kids that if your child is tested positive, it's not just the other kids, it's the staff members. And you might be getting your child giving exposure to a very dangerous disease for someone who might be much more vulnerable. So I just want to point that out as well.
Thank you, Mayor Barrett. Our next question comes from Sharon Bajenda at CBS 58 for Dr. Weston and Director Rausch. As you work with area colleges, are you hearing of any college students intentionally wanting to contract COVID-19 to quote unquote get it over with? And what would you have to say to students who have this logic? It's an issue that was talked about in the UW system in other parts of the state.
So I'll start. I mean, I've certainly heard the mentality. I can't say I've run across individuals that have that goal. I think the response to that would be, one is, we've talked about this before, young people tend not to get as sick, but they don't live in isolation. They interact with their families, they interact with other people when they go out in public, when they go to the grocery store, when they go to the drugstore, their teachers, all the different people they interact with. I think it's also worth noting that, as Mayor Barrett just said, while young people typically don't become sick, some do, and it certainly isn't worth the risk. And I think you also don't know who's around you. Even in elementary schools, high schools, and colleges, there's plenty of people who look and act perfectly healthy, but have diabetes or are on immunosuppressants and things like that, and you very well may not know that. And so those people can get quite sick. And then I think the third reason is we're still learning a lot about COVID-19, and the long-term effects of COVID-19 are fairly unknown. We've seen in young children the multi-system inflammatory disease or syndrome, but we've seen in children and adults cardiac effects with heart damage. We've seen blood vessel effects with clotting, kidney effects, skin effects, certainly neurologic effects with fatigue, loss of smell, loss of taste, and these don't necessarily resolve within a week or 2 weeks. There's people who are months out from the disease and still have these. So it is I would say it's a dangerous disease to play around with and just want to get it and get over. It's not the cold, it's not the flu. We're still understanding what it is.
Yeah, and certainly I would just want to echo on top of all the great things that Dr. Weston said. I haven't dealt with this personally, haven't heard about it personally, but certainly have heard the rumors from colleagues across the state about the getting over it. The thing that we need to be very careful about is if a college student does contract COVID and decides not to stay on campus, that individual is now moving to another part of the state or maybe moving out of state to go stay with their family through their isolation period. And there is a very real reality that when they go home, they expose and potentially give COVID-19 to family members. And we have certainly heard stories about that happening, and we've seen it happen in local health departments where a student comes back to the Greenfield or the Hales Corners area with COVID and then gives it to the rest of their family members as they're isolating at home. So again, I don't think this is something we want to mess around with, but we need to be aware and try to limit that transmission as much as possible.
Our next question is from Patrick Palantonio at WISN 12. For health officials on the call, what, if anything, are you encouraged by with the community response to COVID? And what concerns you most now that we're 6 months into the pandemic?
What concerns me the most as we head into the next 6 months potentially of COVID-19, because I think we have to be honest with each other and understand that COVID will be around for a while, is exactly what Dr. Cousin mentioned moments ago. You know, we have this potentially twin pandemic of COVID-19 and influenza as we come into the influenza season here within the next several weeks. That's going to be very concerning. It's going to be very problematic to tease out COVID symptoms from influenza symptoms. So certainly I would want to urge everybody who's listening to make sure they get their influenza vaccination, because that is one of the best ways to protect themselves from influenza. And then hopefully that will make it easier to control COVID-19. We've had many successes and many challenges over the last 6 months. I think there's a great proportion of the population that's doing all of the great things to limit their transmission of COVID-19. The wearing a mask, watching their distance, washing their hands. But there is a subset of our population. It's something I've talked about previously on media briefings. The collective actions that we take as a community are what drives our COVID-19 disease rates. And because the incubation period is 14 days, the collective actions that we took 2 weeks ago in attending a Labor Day party or attending a backyard barbecue over Labor Day weekend is definitely driving the disease rates. And it has ramifications on our disease rates. So we need to be very cognizant of what we need to do to lessen disease. I know it's not the most exciting thing to do, but wear your mask, watch your distance, and wash your hands are some of the best things that we can do to lessen our transmission going forward.
Yeah, and I think those are great points. I think I'm encouraged for what I'm encouraged by on the county level is how much coordination there's been, coordination between the health departments, the fire departments, the health systems in the response. I think we have a good testing apparatus put together, and I think our health departments are doing a great job tracking and tracing and contacting. I think as far as concerns, similar to what Darren said, I think we're going into a dangerous time here with the flu season, with winter, schools continuing to ramp up. We're only, a week or two into school. And like was talked about, the incubation period's a couple weeks. So we have yet to see really what the impact of school, whether it's grade school, high school, college, I think in particular college, we have yet to see the full impact of that. So I think it is a risky time. I think that there are differing schools of thoughts on an individual level with COVID, to be sure. But I think most people are trying to do their best to do what they think is safe. But like was discussed, it's a community effort. And so everybody really needs to be in it together, because it's not something where if you don't follow the guidelines, you're just hurting yourself. I think if you don't follow the guidelines, you're really hurting your community.
Our next question is also for Darren and the health officials and Mayor Barrett and County Executive Crowley. If there's no moving into the next phase right now, is it possible that Milwaukee and suburban communities will pull back on the current phase if this trend continues?
Yeah, I certainly
can tell you from
yeah, go ahead, Mayor Barrett.
just from a Milwaukee perspective, what we've tried to do all along is to follow the science, and that's my intention, is to continue to follow the science. It's unfortunate that the politics have sort of become interwoven with this, but I think in the city we certainly have tried to do take the advice of the public health experts as opposed to politicians.
Yeah, and then to echo upon that, when we've met as the 11 health departments in Milwaukee County over the past several months, we've had conversations about moving forward and moving back. And certainly we're on the upswing. We're certainly not as high as where we were in January or in July and August rather, but it's certainly something that we need to consider and that we will consider. We need to look at the data and use that data to derive decisions. And as Dr. Weston mentioned moments ago, we've done a great job of putting together data reports, the county data dashboard, and really using that in a way to drive public health actions. So if we need to move forward, we'll move forward. If we need to move backwards, we'll move backwards. Part of the importance of these media briefings is bringing that data to you so that all of the residents can make informed decisions about limiting their interaction with COVID-19.
And just to echo the same sentiments as both of them, in Milwaukee County, we're going to continue to coordinate with all of our 11th health departments. I mean, it is unfortunate that the politics has really gotten to the way, but hopefully as we continue to tackle this, we'll be able to tackle this as one county. But I would also say that we have to make sure that we're looking at different municipalities and seeing what is being done at the same time.
Our next question is from Dan Malloy at Spectrum News 1. Question for the mayor and county executive. How much CARES Act funding has been allocated and how much is left for the city and county?
Well, I can tell you that I'm not sure exactly how much is left as far as what has been spent, but we have pretty much allocated all $77 million that we have received in CARES Act funding, if I'm not mistaken. And so we've made sure to create that flexibility for all of the programs in case we need to move money around. But from my knowledge, all of the money has been allocated, not necessarily spent.
It's very similar for the city of Milwaukee, although we've got some CARES Act CDBG dollars, which is a different pot, and some of that money can be used in 2021. And so in introducing my budget, I'm using some of that money for CARES Act related issues, for example, in the health department. But by and large, we have allocated, and I know in some communities, at least I read the news reports that they had difficulty as to how to spend it. We did not have that difficulty. We had, between all the different aspects of where we're spending the money, from tenants, helping small businesses, obviously the health department and other police and fire, we've needed that money and we've allocated it.
Thank you, Mayor Barrett and County Executive Crowley. Our final question is from Patrick Palantonio at WISN 12. We're hearing that the health department may be going into the rescue mission in Milwaukee to investigate cases. Is that true? And can anyone provide more information?
I don't have any information on that right now, but Patrick, we're more than happy to get it. Dr. Weston might have something he just went on, so I'll let him respond if he wants to, but I can check on that for you as well.
I had the same answer. We can check into it. Thanks.
That is all of our questions in chat for now. Thanks for joining us again today. We'll be back next Tuesday.
Thank you all very much.
Thanks, everyone.
Thank you.